Hello.
Hi, my name's Jen Snyder. I'm calling on the behalf of the Baltimore City Health Department. Can I please speak with Barry Green?
Speaking.
Hi, Mr. Green. Is English your preferred language?
Yes.
Great. I have some important health information I need to share with you. To be sure I'm speaking with the right person, would you please confirm your date of birth for me?
Sure. January 1st, 1950?
Great. And what about your address?
225 West Main Street, Baltimore?
Perfect. Thank you. Do you know your test date for your coronavirus test?
Yeah, I was tested a couple days ago. I think it was June 23rd.
Great. And do you know your insurance?
Let me check. Hold on one second.
Sure, take your time.
Yeah, it's Blue Cross Blue Shield.
Great. Thanks for providing for me. I'm calling because you were recently tested for COVID-19. Has your healthcare provider already spoken to you about the results of your test?
Yeah, they have.
Okay. And so I have some questions I need to ask you about your symptoms and your activities over the last few days. And I'd like to discuss with you whether there are any resources you might need. We'll talk about next steps and try to address any concerns you might have, all right?
Okay, sure.
Before we begin, I want you to know that what we discuss today will remain confidential. Any information you provide will only be shared with the local health department staff and persons involved in providing follow-up support.
Okay.
So I want to begin by confirming some of your contact information for you. I have your full name as Barry Green, and your home address.
225 West Main Street, right?
Oh, that's not quite what I had on file. Let me add that here. And that's in Baltimore City.
Yep.
All right. What's the postal code there?
21201.
Great. Just bear with me while I enter the information. I know it's going to take a while, so thanks for your patience.
Sure, no problem.
Okay, so what's your home phone number?
It's 443-964-2140.
Great, thank you.
Well, that's actually my cell phone number, too.
Okay, I'll put that down for your cell phone. Is that the best number to reach you at?
Yeah.
Do you have an email address that we could use to contact you?
Yeah, it's bgreen, Green,
Mm-hmm.
at me.com.
Mm-hmm. Great, perfect, thank you. Okay, so next I'm going to confirm some additional information. What is your sex? Do you identify as male, female, or other?
I'm a man.
Okay, thank you. Are you of Hispanic, Latino, or Spanish origin?
No.
Okay. And what's your race? You can choose one or more of the following. The options are white, black or African American, American Indian or Alaskan Native, Asian, Native Hawaiian or Pacific Islander, or other.
I'm black.
Okay, thank you for providing that. So, Mr. Green, during the last 14 days, have you worked in, been a resident of, or visited any of the following facilities? Either a nursing home, an assisted living facility, an independent living facility, a correctional facility, dialysis center, group home, school or college, a homeless shelter, child care center, or anything similar to those?
In the last 2 weeks? No, I don't think so.
Okay, perfect. Thank you. Have you gone to work in the last 14 days?
Yeah, I have.
Okay. So what's your employer's name, address, and phone number? Let's start with the name.
It's John Thomas.
Okay. And what's the address there?
We just moved offices. Our office is downtown. It's 20 South Charles, and that's Baltimore, 21201.
21201. Okay. And can I get a phone number for John Thomas?
Yeah, sure. It's 410
Mm-hmm.
752 2368.
Great, thank you. What's your occupation? What do you do there?
I'm a professional. I work with the staff of the law firm.
Okay, are you an admin?
Yeah, I'm an admin.
Okay. Great, thank you. Bear with me. I'm just putting my notes in the file so that we know who you may have been exposed to. What's the last date you were physically at work?
What's today?
Today is Wednesday the 24th.
Well, I was there on Monday, so I guess the 22nd.
Okay, perfect. So you said it's a law firm, not a healthcare setting. Do you work for any other employers?
Nope, that's my only job.
Okay, great. Thank you. All right. I now have some questions about your current health status. Do you currently have any of the following conditions? I'm going to ask you these one by one. I assume you're not pregnant.
No,
Do you have diabetes?
I don't.
Are you obese or overweight?
Well, it depends who you ask, but probably not.
Okay. Do you have a history of cardiac disease?
I don't.
How about hypertension?
Is that high blood pressure?
Yeah.
Yeah, my doctor says I have slightly high blood pressure.
Okay, perfect. Not a problem. I'm just going to mark that in the file. How about chronic pulmonary, kidney, or liver disease?
I don't think so.
Any other immunocompromising conditions?
Not that I know of. My blood pressure's just a little high.
Okay, great. So there's nothing else that you think we'd be worried about?
Sometimes I wear glasses, but otherwise I think I'm fine.
Okay, perfect. Thank you. Have you smoked at least 100 cigarettes in your entire life, Mr. Green?
100 cigarettes in my life? No, I don't think so.
Okay, perfect. So now I'd like to ask you some questions about how you're feeling and symptoms you might be experiencing. How are you currently feeling?
I'm okay. I'm not great, though.
Okay, it sounds like you're having a little bit of difficulty breathing.
Yeah. I don't know. No, not really. I'm okay.
Okay. If at any point you think you're having difficulty breathing or you think you're having a medical emergency, let me know and I'll be happy to call 911 for you.
Okay, thanks.
Okay. Have you experienced any of the following symptoms in the past 14 days? Either cough, shortness of breath, or difficulty breathing, fever, chills, muscle pain, sore throat, or loss of taste or smell?
Yeah. I mean, I don't think I've had any muscle pain, but I think I feel like I've been running a little hot, so maybe a little bit of a fever. And my wife said I've been coughing a little bit.
Okay, great. Thank you. So you said cough, fever. Have you been experiencing shortness of breath, chills or muscle pain or sore throat?
No, I don't really think so.
Okay. What date did you know what date the cough began?
I felt pretty good this weekend, but I felt a little raspy, so maybe I started coughing Saturday night, maybe Sunday. So I don't know, three or so days ago.
Okay, Sunday. Put the 21st.
Yeah, that's probably when it started.
Great. How about the fever? Do you know what date that began?
It was after the cough. I mean, I haven't taken my temperature. I just feel like I've been running a little hot. So maybe Monday or Tuesday.
Okay, I'll put Monday just to be safe, the 22nd. Have your symptoms improved at all since they began?
No, they've been pretty consistent.
Okay, thank you, Mr. Green. All right, so now I'm going to ask you some questions about your ability to isolate and any resources you might need. Isolation is critical to preventing the spread of the virus. You're required to stay home except to get medical care. You should not go to work, and you should advise your employer that you have tested positive. You must stay separated from other people by at least 6 feet, but the more distance, the better. Cover your cough and sneezes. Wear cloth masks. Avoid sharing personal household items. Clean your hands often. Disinfect high-touch surfaces daily. Try to remain in a separate room from other household members at all times. If you have to be in a room with others, wear a face mask that covers your mouth and your nose. Avoid the use of common areas as much as possible. So, Mr. Green, how many people live in your house, including yourself?
It's two of us. It's me and my wife.
Okay, perfect. Thank you. We'd like to remind you that it's more important than ever to practice strict isolation. With careful isolation, you can help keep your family, friends, and neighbors safe. So within your home, do you have your own room and ability to isolate from others? This might include a separate bathroom, kitchen, or a person to prepare and deliver food.
Not really. We live in a house in Baltimore, so it's not very big.
Okay, no problem. I completely understand. At the end of the call, I'll provide you with a phone number for the local health department, so you can also call them if you have any additional needs. Right now, I'm going to need to collect information about each person in your household. For each person, we'll be contacting them directly to let them know of their potential exposure. So what's your wife's name, Mr. Green?
My wife? Her name is Charlotte. Charlotte Green.
Okay. And what's the best phone number to reach Charlotte?
We don't have a house line, so her cell phone would probably be the best number.
Okay, would you mind providing that for me?
Yeah, sure. It's 443
Mm-hmm.
872
Mm-hmm.
1463.
Great, thank you. Can you confirm Charlotte's date of birth?
Yeah, sure. She's a little bit younger than me. Her birthday is July 12th,
Mm-hmm.
1958.
Okay, July 12th, 1958. Got it. And your wife is female?
Yeah.
And what's her primary language?
She speaks English.
Okay, great, thank you. Is she having any symptoms?
No, she seems fine.
Okay, that's good to hear. And is there anything else about her that you think might be relevant?
Other than the fact that, we live together and I'm not doing so great, I don't think so. She's pretty healthy.
Okay, glad to hear that. Thank you. So now I'm going to ask you about your daily activities starting 2 days before your symptoms started on June 21st. This will help find any potential people you might have come into contact with. For each person, we will be contacting them directly to let them know of their potential exposure. Remember that everything we say here will be confidential, and they will not be told anything about identifying information about you. It can be hard to remember several days back. It might be helpful to remember by looking at your text messages, calendar, email, photos, or social media threads. Let me know if you need a minute to gather any of that information. Okay.
I think I'm okay.
Okay, cool. Let's get started with June 19th. Beginning when you woke up, where did you go and who did you see? What'd you do and where did you go? And who did you spend time with?
June 19th. June 19th. What was that? That was last Friday?
Mm-hmm.
Well, I was off that day, so I don't think I think I just spent most of the day at home, other than maybe a quick errand here or there, but I was at home.
Okay, so you wouldn't have gone anywhere with 10 or more people, no crowds?
No, definitely not.
Okay, perfect, thank you. So on that date, did you spend more than 15 minutes in close contact with anyone? It sounds like that's a no.
Yeah, I don't think so.
Okay. Bear with me while I click through the dates. We're going to have to review every date since 2 days before your symptoms started. How about on June 20th? Did you go anywhere or do anything where you might have encountered more than 10 people?
That was Saturday, right?
Mm-hmm.
Yes, Saturday. I went to a restaurant in our neighborhood and got some food.
Okay, do you know the name of that restaurant?
Yeah, it was Johnny Rad's.
Oh, okay, I know that place. All right, so you said that you were there on June 20th. Do you know about what time?
It was like a late lunch, so I think I probably got there at, I don't know, 2:15.
All right, perfect. That works for us. All right. I'm going to click through. So besides your wife, who we already recorded, was there anyone else you came in close contact with that date?
On Saturday?
Yeah.
No, I don't think so.
Okay, perfect. All right, I just have to click through. Thanks for your patience while I work my way through this system. It's a bit cumbersome. All right, moving on to the 21st. What'd you do on that day? Did you go anywhere, interact with a bunch of people?
Well, that's Sunday, right?
Mm-hmm.
No, I don't think so. Oh, hold on. Yes, Sunday morning. Sunday morning, I went out for coffee with one of my friends.
Okay, perfect. I'm just gonna probably need to get your friend's information. What's his or her first name?
The guy I had coffee with.
Mm-hmm.
His name is Tim.
Okay, and his last name?
Jordan. Tim Jordan.
Okay. And do you have Tim's phone number?
Yeah. Hold on. I gotta look it up on my cell phone. Give me 1 second.
No problem. Take your time.
All right, scrolling through. Tim. Yeah. Tim's best number is his house number.
Okay, what's that?
It's 410
Mm-hmm.
638 2412.
Perfect. Thank you. And do you know Tim's house address?
Yeah, he lives over in Pigtown. He's on 21st Street.
Okay. You don't know the exact address?
I don't think I know exactly, but I can look it up. Let me ask my wife.
Sure, take your time.
You know what? I was wrong. Tim lives just off MLK on Packer Street. It's 36 Packer Street, Baltimore, Maryland, obviously, and that's 21231.
Great. Perfect. Thanks so much. Do you know how old Tim is?
He's a little bit younger than me. He's probably 63, 60, mid-60s.
All right. That's a good ballpark. We'll take it. All right. So Tim is a male. Is that correct?
Yeah, it's Tim.
Okay. And what's his language? Does he speak English as well?
Yeah, I think he only speaks English. I don't know.
Okay. Do you know if Tim's had any symptoms?
I don't think so. I mean, I haven't talked to him since Sunday.
All right. Anything else you think might be important about him?
No, I don't think so.
Okay, great. Thanks, Mr. Green. Okay, so on the 21st, did you spend time with more than 15 minutes with anyone else other than your wife or Tim?
No, I don't think so.
Okay, great. Thank you. Okay, now we're on to the 22nd. You want to take a look at your calendar? Did you go anywhere where you might have interacted with more than 10 people?
More than 10 people? No, I definitely not more than 10.
Okay. And did you spend more than 15 minutes in close contact with anyone other than your wife and Tim?
That was Monday, right?
Mm-hmm.
No, I don't think so. I only went into my office for a couple minutes to pick up some papers, but I was in and out in 5 or so minutes.
Okay, great.
Yeah, because I didn't even have to pay for parking.
There you go. And on the 23rd?
That was yesterday, right? No, I didn't see anybody yesterday. I just did work from home.
Yeah, I'll bet you worked from home because you were starting to feel symptoms. That's a good idea. All right, I'm just going to click through and mark that you didn't go anywhere yesterday or today, right?
No, I didn't go anywhere yesterday, and I haven't done much today.
Okay. Well, I'm glad to hear that. Best to be careful, right? Okay, thanks for answering those questions, Mr. Green. Now we're going to review next steps. Individuals with symptoms caring for themselves at home may discontinue isolation when the following are met. At least 10 days have passed since symptoms first appeared, and there have been at least 3 days since recovery, which means you haven't been experiencing fever without the use of any drugs, and you've seen improvement in the other COVID-19 symptoms, which are cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, or new loss of taste or smell. So this means your isolation period will be a minimum of 10 days from when your symptoms started, but it could last longer depending on your recovery. We're required to follow up with you every 3 days until you have recovered and can be released from isolation. We'll need to ask you just a few more questions to see how you're doing. Remember that your personal data will be kept confidential, and if you have any questions, you can view our privacy policy and terms at coronavirus.maryland.gov/pages/contact-tracing, okay?
That was really long. Are you guys going to be able to email that information to me?
Yeah, I think we can do that. Give me 1 second to get to your information. First, let's talk about follow-up. We'd like to follow up with you by text. Message frequency varies, and message and data rates might apply as normal. You can reply help to get assistance or stop at any time to opt out. Do we have your permission to send you SMS messages to follow up?
Is a SMS a text?
Yeah.
Yeah, you can text me. I have unlimited texts.
Great. What's the best number to text you at?
My cell phone number, what we discussed earlier.
Can you remind me what it is? I'm sorry, I just have to re-enter it into my system.
Yeah, let me look back. I think it's 443-974-3218.
Okay, great. You'll get an SMS from us to confirm that you want to receive follow-ups by text message. Please reply enroll to that message that you get to start receiving those messages.
So you're going to text me and I should just say enroll.
Correct.
Will the text say that?
It'll provide the instructions.
Okay, great.
So before we end the call, I have some information for you about seeking medical care. If you have any of the following emergency warning signs for COVID-19, you need to seek medical attention immediately. If you have trouble breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or to stay awake, or bluish lips or face. And remember that this list is not all possible symptoms. Call your medical provider for any other symptoms that are severe or concerning to you, okay?
Okay.
And call 911 if you have a medical emergency. Notify the 911 operator that you have COVID-19 and have tested positive. If you can, put on a cloth face covering before the medical help arrives. Would you like information or additional resources, including a phone number that you may call if you have any questions?
No thanks.
Okay. You said you wanted that information via email before, is that right?
Yeah, that would be great.
Okay, can you remind me of your email address?
Yeah, sure. It's bgreen
Okay.
at me.com.
Okay, great. Thank you. So, Mr. Green, will you need a letter for your employer? A lot of employers want documentation to account for people missing work.
No, I think I'm okay.
Okay, great. If you need that at any point, we can provide it for you.
Okay, great.
The local health department may also be in contact with you. While we're trying to streamline our outreach, there might be some overlap. So if you do get a call, you can inform that you've already spoken to me and that they can verify that your information to ensure you have the services you need.
Okay.
Okay, great. Thank you, Mr. Green, for taking the time to speak with me. I hope you begin to feel better soon. Have a good day.
Okay, thanks. Nice chatting with you.
Thanks. Take care.